So this is going to be the history of the preventive care program, the program that the world needs. And I will talk a little bit about that in more details as we go through the presentation. This program is started in 1972. So next year we are going to accomplish 50 years. So we might need to celebrate somehow. But can you imagine, I mean, almost 50 years of a program. It's one of the oldest programs in the School of Public Health, for sure. It started with the name Doctor of Health Sciences. And then the idea that Dr. Mervyn Harding, the guy that is in the picture here, he has an idea to graduate, to train professionals that will work side by side with physicians for supporting lifestyle modification. That was the main idea, because the physicians were not trained for lifestyle on that time. Even today they are not, except by those that are in Loma Linda. But outside, physicians have a very short view of lifestyle modification. Dr. Harding also was he graduated from DrPH in nutrition in Harvard, and then he had another DrPH or PhD in pharmacology from Stanford University. He was the director of the General Conference Health Ministries for 5 years, as you see here. And he died in 2010 with 96 years old. Wow. He founded the School of Public Health in 1967. So you see that there were only 5 years difference between the starting of this program and the School of Public Health, the starting of the School of Public Health. So after Dr. Harding, we have a few other directors, and I am not sure about the timing of those. I try my best to get the timing of those. But Dr. Gunter Fuchs was, as I know, from 1979 to 1985 as one of the directors. He graduated in 1979, and then he was the founder of the Center for Health Promotion, and that is a historic thing, because the Center for Health Promotion started with preventive care, and now they are in the hands of the medical center and the hands of physicians, and we barely go there. But that's where he started it. He was the director of weight management and spa in San Diego in 1984. When we asked him to come to Loma Linda a few years ago to do a speech for our preventive care grand rounds, he mentioned that the School of Public Health, and especially the preventive care program or the Doctor of Health Science, they used to have this spa in San Diego that was donated. It was not donated. It's a lady that has the building, and then she said, you guys can use that. I will give to you for use, will not charge. It looks like they have to pay the taxes only. And then they use that for weight management. And this was historic, but it stayed for a few years only, and then they closed down. Dr. Fuchs is the director of the Fox Group. That is a healthcare consulting group. And he founded that in 1989. He is experienced in operational and strategic management of physician medical groups, development of acute care facilities, and governance of nonprofit community primary care entities. So he didn't stay much on preventive care, but he is still in the area of consulting. Well, the third director of the program was David Niemann. David Niemann was, for sure, he is one of the most famous director and graduates of our program. He's still alive. He is a professor in the Department of Biology from the Appalachian State University. He graduated in 1984. He is the director of the Human Performance Lab at the North Carolina Research Campus of the same university. He has recruited more than $10 million in research funds from grants. He published more than 370 peer-reviewed articles. He is the editor-in-chief of the sports nutrition section of the Nutrients Journal, Nutrients and Frontiers in Nutrition. He sits from 10 journal editorial boards. He has citation being cited more than 40,000 and has authored 9 books. One of them we use in the exercise physiology for years. When I finished my course, I studied his book. When I was starting preventive care, we have the exercise physiology course that was using his book. He served as vice president of the American College of Sports Medicine and ran only 58 marathons. Then we have Dr. Blix. In 1992, Dr. Blix took over the preventive care, the Doctor of Sciences, and he was the one that changed this name from Doctor of Health Science to DrPH, Doctor in Public Health in Preventive Care. So on that time, the program started to have a dissertation in a huge time for internship. We set up this time. The dissertation was almost 1 year. And the field practicum, the practice was almost 1 year with 1,400 hours in the program. I did that. It's almost 1 year only doing dissertation sites. Dr. Blix also founded the Healthy People Conference that we are not running that a few years ago, unfortunately. And I believe this was because of lack of administrative skills, because many other universities have this conference, or their conference, and they can raise money for that. Loma Linda was losing money, and because we didn't have the administrative ability. He was the assistant dean of the School of Public Health and would be the next dean. I was sure about that, but he died with cancer in 2002, unfortunately. And so we miss him very much. And he was my mentor and mentor of many of other graduates that we have in the program, still working in the field. Then we have Dr. Fujimoto. Fujimoto started in 2003 and stayed until 2007. He was a former nuclear engineer. Can you believe that? And he graduated in 1982, so was one of the oldest graduates. He used to work in Hawaii and in Japan in the health promotion departments there. And then after he left Loma Linda, he was the director of research and lifestyle medicine at the New Hope Medical Center in Nevada. And then after him, we have Dr. Torstad. In 2007, she started the program and stayed until 2000. And he was not even 14, he was 13, if I'm not wrong. She was the only one that didn't have a preventive care graduate degree. But she was a physician emphasizing or specialized in research in preventive cardiology, mostly obesity, lipids, and smoking cessation. So all areas of preventive care. So she brought a little more strength to the research program. And then one of the highlights was her grant with the Ardmore Institute of Health of $100,000 for the fiber study. And then in 2014 to the present, I am in charge. I mean, they call me to be the director of the program. In last year, we put the program online. In fact, we put the program online for the simple reason that the program was closing down. We only have 1 or 2 applicants in the last few years. When I start the program, we have 40 students. So by the year 2019, I have less than 10, and then only 2 each year applying for the program. So we had to put online, and now that we put online, we have 25 students, and by the fall, we will have 35 students in the program. So it was a good idea. And I'm not saying that because of me, because this was our committee. We have a subcommittee, and I will show you the subcommittee responsible for that measure. So now we have the preventive care grand rounds, we have the preventive care research group, and we have the Dresden Center Office of Preventive Care that I will show in the program, the activities that we do. We also run the full plate diet, and lately, last year, we created the Loma Linda Light, that is a support group for weight management. And we run that in the Campus Hill Seventh-day Adventist Church. And now we are planning to run in other places as we can find them. During this, in the middle of the things, like between Dr. Torstad and me, was Dr. Arachika. I believe he was 1 year director. Dr. Torstad, Dr. Modeste also was a director, and I don't remember which time. And Dr. Dysinger was also director for a few. I'm not sure if he is gone. It was more than 1 year. Then we have the famous alumni of the program. I will emphasize the ones that I know. I know that we might have more people. I know that there are more acknowledged preventive care specialists, but those are that I have acknowledgement. Dr. Hans Diel for the CHIP program is the one that started the Complete Health Improvement Program. Dr. Lee Burke, that is still with us, is still a member of our subcommittee. He was the first one to develop research on laughing and the immune system. And he is the assistant director, assistant dean for research at the School of Allied Health Professionals. And then Dr. Hall. Dr. Hall is, besides his success in the WellSource incorporation, he is one graduate from the School of Public Health that was the first person to start health risk assessments in the country, and I would say in the world. And health risk assessments computerized. So he was very good on computer and things like that, and he designed a program for corporations, and very successful create the WellSource that has hired some of our preventive cares, has influenced corporate health in all around the world for more than 40 years. Last time I talked to him, he was doing his programs for in Saudi Arabia for the, if I am not wrong, the Aramco is the biggest oil company in the world, and they just have 7 million employees. So that was for you to have an idea about him. And also Dr. Hall is, as I know, the oldest graduate in the program, 1978, and the one that is retired but still active. He still is doing something on his company there. I mentioned that because I I have an interview with him next week for one of our programs, and he said that he could not make because he has some meetings at his company. And he just wrote a book about exercise and the immune system. So if you are interested to know about that, just Google Dr. Don Hall and put exercise and immune system, and you will find the book. Both, I think it's Pacific Press, the hard copy publisher, and then he has on Amazon too, online. Roy Vartanian is the guy that started the NutriPoint system. And then he wrote this book, NutriPoints, that was translated in 10 languages in 13 countries around the world. I like his goal, to live at least to 100 years old in good health and help as many other people as possible to come along with me. So he is, I think he's going on that direction. Then we have Dr. Fred Harding. Fred Harding is the son of Mervyn Harding, the founder of the program. He's a good friend. He's the Associate Director of Health Ministry Department of the General Conference of the Seventh-day Adventists. He was one of the first graduates in preventive care who did also a registered dietitian degree, and then combined the two ones was a very smart move, as you can have access to clients early, and then you have the expertise of a dietitian and also the other lifestyle components that the program is training for. I say that it's important to have access to clients, because this was one of the dropouts of the program, one of the struggles of the program. We have this program for 40 years and we never made the mainstream medical system. We could not make it because our graduates could not have access to patients, and somehow the program was, we create a very sophisticated professional that was at sometimes at almost at the same level of a medical doctor, but in terms of lifestyle. But we didn't have a place for that. The professional was too expensive. So I have graduates that spend more than $100,000 to finish the program, and then they could not find jobs to pay off their loans. And then that's a very very high problem that we solved. That I will show you at the end. Well, if I forget, I mean, we solved because we decreased the amount of units. We decreased the price of the program, and now the program is shorter. The program is not that expensive, and the program has components like the health coach that the profession, the preventive care specialist, can have access to patient, and in the future it will be reimbursed if they have the health coach by the insurance, by Medicare, and by the insurance, as the American Medical Association is studying, is considering, and in the present they are with mechanisms to approve CPTs that are codes that provide reimbursement for health coaching and also for certified health education specialists. One of the famous alumni is Carlos Crespo, who was also a member of the CDC for the National Center of Health Statistics. He's still a consultant for exercise for CDC, and his expertise is in exercise for minorities. He has several publications. We invited him one time to speak to us, and he is a good fellow. and famous for his interventions and research on exercise and nutrition. Dr. Jonberg, who is the one that started with Diabetes Undone. He worked 14 years at the one Seventh-day Adventist clinic, developing there a lifestyle clinic. I visited with him in 2004 or something like that. I visited on that clinic because I was in Hong Kong on that time, and I need to have a little more skills on how to develop lifestyle prevention at a clinical level. And both him and Dr. Keith Horinushi, another one that was working with him. By the way, Keith Horinushi is still working with a private lifestyle clinic in Guam. I know that because I have one of our graduate students that is Ron Paulino, that is working. He graduated here, he went back to Guam, and for a while he worked with Dr. Horinushi on his clinic. Dr. Wes Jonberg has authored 3 books, Goodbye Diabetes, Hello Healthy, and Memory Makeover, when he is making a point of lifestyle and the prevention of Alzheimer's. Dr. Gunter Fuchs, who was a professor in the School of Allied Health and the School of Public Health. I used to work with him, and he was my professor on stress management. And then we used to work in a facility together when I was a student. He is a psychologist. And Jacqueline Chen, who is, I believe, retired and living in Hawaii. She was the one that did the research on water and in the Adventist Health Study, proving that drinking more water prevents heart disease or heart attacks. And she was a good friend. We graduated together almost the same time in the School of Public Health Preventive Care program. Then we have other famous graduates. Dr. Mariellen Westerberg, that is now a CEO for the SAC clinic. Dr. Louise Schneider, that used to work in the School of Allied Health in the dietitian department. We even didn't know that they were preventive care. And when I checked the list, I found her name there. Gigi Kwok Hinsley is graduate from our time. She was my student. And then she is now a very important research scientist in nutrition. She works for Amway company, but she is a very top research in the area of nutrition supplementation and nutrition research. Dr. Brenda Rea works for the Center for Health Promotion, is also a graduate from Preventive Care, and she is a medical doctor. And Dr. Ella Haddad, I didn't know that she was a graduate from our program, but yes, she is a professor in nutrition, but she is one of ours. Dr. James Peters was a director for the Santa Elena Health Lifestyle Program, and he died a few years ago, unfortunately. But he was famous for his program in Santa Elena, and I believe his wife is still running the program. That is one of the only hospitals that run a lifestyle center in their facility, and was for many years famous and successful. They have several research papers showing the results of the program that they call, I think was top 10 or same. It's 10 days that the clients stay there for their lifestyle program. Dr. Rosario Sakamoto is a professor in the Fullerton University, and Dr. Brian Haddock, that is a professor of exercise science in the Cal State University, San Bernardino. Here we have Dr. Haddock graduation. If you can recognize Dr. Jerry Lee here, Jacqueline Chen here, Dr. Blix is on the left side. And right behind Dr. Haddock, we have the Dean of the School of Public Health, Dr. Helen Hopp-Marshak. That was, in that time, a kind of, she was a member of the Dr. Haddock's research committee, dissertation research committee. I think I lost the presentation mood. We'll go back here. So this is our program now. Practically, I am the only full-time in the program, and we have Dr. Medina and Dr. Palani that are part-time faculty. We have 25 students. We have 17 students online, and then we have 10 more students for next year. So this is our subcommittee that we have here. Dr. Medina, Dr. Palani are members of that, of course. Dr. Arachika, Dr. Moses, Dr. Nelson, Dr. Gudo, and Dr. Burke. We have one member that we had a few months ago, Dr. Don Hall, that is the oldest graduate of the program, as I know. And then he became a member now for the first time of our subcommittee. And I have to mention Mary Hawk. I was trying to get her picture, but I could not find. But I talked to her that I will mention her name on the presentation, and she said that I am here to serve. She is a very sweet lady and has helped us a lot on the records of the program. So we have the preventive care grand rounds. Those are, we start that in 2009 or 2010, something like that. And this is when we invite both graduates and faculty and experts in the area of preventive care or the area around preventive care. And then we talk, this is Dr. Juan Carlos Beliard, a friend of us that present a topic on the importance of community partnership during the pandemic. We founded also the Preventive Care Research Group. And this we found maybe 4 years ago within the program. And then one of the main two reasons for that was, first, we have several students that have finished their paper and never published. So this is a shame for our program. We have so many good studies that were never published. And then when we found the Preventive Care Research Group, we were able to review those articles and publish them. The second is to have more options for and support for our students in their way for the dissertation program. So we have helped a lot of our students, and some students have published with us, like Wes Reis. Wes Reis is from Brazil, is my friend, and he entered in the program. And during this process in the Preventive Care Research Group, we have 8 publications together. Well, you might say, okay, I mean, what kind of publications? Well, I don't care much about that, because I feel that if it is a peer review journal, it's good. And then those are publications that we would never be published. They were abandoned. The students finished, they left, they never reviewed the thing, and we contact them over and over and over. They were not interested in publish, so we took over and we did it. So we have my colleague, Michael Palani, who was one of my graduates in 2009, and he was the first one to start the Dresden Center Office of Preventive Care, as I'm going to show next. And he is an associate director for the Preventive Care Research Group. This is our group. I mean, we have on the right Michael Palani. On my right side, we have Tony Jerry. We published some papers on the full plate diet clinical trial. Then on my left side is Wes Reis, is the guy that I mentioned, who published with us 8 papers from older students, from former students of preventive care. So we have done 20 publications since we started, and then 14 was from all former studies, and 6 for dissertations. We have done about 7 cross-sectional studies in the program, and the one that we are just finishing, I finished yesterday night the reviews and sent for my supervisor for her signature, and we will send to IRB for approval the Loma Linda longevity study that we will assess all the guys that are in the area of San Bernardino and Riverside. We are comparing people with 80 years and older, both Seventh-day Adventists and non-Seventh-day Adventists, and with different races. And we have a questionnaire for that. So if you want more information about that, please let us know. And if you want to participate in some of our research, let us know again, because we are always looking for more participants. So this is our current preventive care research group. We have Dr. Josileide, she's not a doctor, Josileide Gaio, that is a statistician. She is the wife of Wes Reis. So both are from Brazil, so good folks there. And then we have Abel Alvarez, that is my assistant. He is a doctor in preventive care student, and he's a medical doctor and finished a master in epidemiology. Then we have Dr. Rhonda Spencer, that is an epidemiologist. We invited her to join our group, and she is happily with us, especially during the longevity study. And Diane Hunt, that is a master in public health registered dietitian student. She is my assistant. She worked for us in the Dresden Center Office of Preventive Care. This is our group. We have still 19 former papers from graduates that never published. We are trying to work with them. We are trying to work with new guys to see if we can revise those papers. We have submitted in the last year about 7 papers. Due to the COVID, the review of those papers have been very slowed down. We still have dissertations to go through. We believe Wes will finish by the middle of 2021. I mean, we expect that he will finish by the end of 2021, maybe the beginning of 2022, and then we have 4 more for the end of 2022. This is an example of one article that we published in the Journal of Mind and Body, Advances in Mind and Body Medicine. And then this was an article by, this was by Joe Raphael. Joe Raphael was the publisher. It was very interesting because we got this article and he finished the program maybe in 2014, 2013 or something like that. And then I struggle with this article, sending to several different reviewers, and people are saying, well, this is too old. Things have changed. You cannot publish that. The issues are not good. I mean, the stress information is improving. The inflammation is much more advanced now. And through all of this, I went, and then finally, we work mostly with Wes Reis and Josileide Gaio. We were able to review, and we submit, and we publish. And it's not the high top journal like the American Journal of American Medical Association that has an impact factor of what, 20 or more, is an impact factor of 171, but is still a good one. And we published the paper. And this paper is from the Adventist Health Study, the Religion and Health Study, coordinated by Dr. Jerry Lee. That was otherwise would not be published, and that's the point. These papers are kind of rescued, and I consider myself a bounty hunter. For those that know what means, I don't go after bandits or assassins. I go after students who missed the boat to publish, and I publish and I put their name on the publication, and sometimes I even put the reviewers as first authors. I mean, Dr. Wenes Reis has been a full author, a first author in several papers that we publish. Those are the activities that we have been involved. We have 2 grants of $25,000. Is nothing compared to other professors and other researchers in the school or in the university, but it's something. For preventive care is great. And so we have 2 clinical trials that we conducted. One was the full plate diet clinical trial, and the other was the white collar workers and sedentariness that was done by Brenda Coranda, one of our students that graduate this year. Brenda Coranda is the second on the right. She was the graduate, the only graduate in this year. So this is the full plate diet group that we took a picture with them. Then we will talk a little more about the Drazen Center Office of Preventive Care. What we do there. We have health assessments to the community and to Loma Linda students. We do lifestyle counseling. We do health coach practice. By the way, I did my 50 sessions of health coach in the center. We do health expos. We do health seminar and lectures for the community and churches. And then we help the churches with their health ministries. Those are the staff that work for me there. As I mentioned, Diane is my main assistant. Dr. Alvarez is another assistant. I cannot go without mentioning Marieka. Marieka is a volunteer for us, is our PR, public relations person. Wherever she goes, she talks about our program and our center and our activities. She went to talk to several people. She went to talk to my boss in the School of Public Health, telling them how great is the work that we do. Sometimes I think I have to pay her for that, but she's volunteer. This is the Herbivore Festival in Yucaipa, and Brenda Coranda, one of our students, is doing a counseling after the results for a client that came by. We are involved in some projects. We are involved in the Moscow project. We are still trying to get together with the Campus Hill Church and Rancho Cucamonga Church and try to be involved on the church planting program that they have in Moscow. We were together with the Mansfield Seventh-day Adventist Church, but the school, the university didn't approve our project. So the idea is to replicate what we do in Drazen in the church over there in Mansfield, Texas. But unfortunately, we didn't have the approval for that for legal reasons, for whatever, or for COVID reasons. I never know what was the reason. So we still have the Loma Linda Light that we are now in the phase of looking for other center to install it. We are also a center for lifestyle training. We train students, all the nursing students for the RN program go through our center for training. A few medical students, I would say 1/4 of the School of Medicine students, also come to Drazen Center Office of Preventive Care for training in lifestyle. And all the physician assistant students, they also come for assessments and for an idea of having an idea of what is that lifestyle is all about. We do lifestyle assessment for other corporations. We have done in the last few years assessments for all the workers from the Southeastern California Conference, and they pay us for this. They pay $25 for each worker. So unfortunately, we do that one day per year, and then we cannot do many workers in only one day. But is good for the clinic, is good for the workers. This is our health fair that we did with Rancho Cucamonga Church while they were doing a project in Rosina. This is in a high school north of San Bernardino City. This is a list of places that we have been developing health fairs and health activities. We go to senior facilities. We present to some departments in the school. We have the university records. All of the employees there came to Dresden for their assessments. We went to the support groups, Mended Hearts, and we present lectures there. And then we have done assessments and lectures for the prostate therapy programs where they have their support group for prostate cancer. This is a picture of our center. If you visit Loma Linda, go to Dresden Center and please come to our office. We have done several preventive care health expos. I would emphasize here that we have been international. We have been to Jamaica and Trinidad with one of our students together on those trips. And then we went with Hands International and participated in health fairs there. We have been to Redlands Bowl with a school and present some of our assessments there. We have been to New York with the Project Change and present some of our services there. We don't have report here, but we have been in San Diego and conducted health assessments and lifestyle counseling for the public health conference, public health services that we have. I mean, what they call public health group. I forgot the name here, but it's the ones that are officers for Public Health Corps. I think it's Public Health Corps. And then we present that because we have a few students. Nicole King is one of our graduates that is one of the Public Health Corps officer. This is one of Health Expo that we conducted at Dresden. We have conducted in the last 3 years, we have assessed more than 3,000 people. Then we have here, in this group was dietitians with Dr. Paulani. And then we have our students, we have interaction of the dietitians. So this is another thing that happened in the Dresden Center Office of Preventive Care. We have interaction with other professionals, or at least with professional students. So in this group, we have a dentist, we have dietitians, we have health educators, we have health administration students and dietitians. We also have interaction with medical students, as I mentioned. We have interaction with physician assistant students, and also with nursing students, as I mentioned. So it's very good for the profession of preventive care to work with those different disciplines and see different aspects of prevention or different aspects of health when you conducted prevention activities or prevention interventions. So this is a picture of our health, one of our health expos. And by the way, this student was a dental student. And this is a nursing student doing health and age assessment. This is volunteers. On the left, we have Marieka, Dr. Michael Polanyi, and Rayan. Rayan Leal is one of preventive care students. By the way, this picture is important because we have a Facebook group. So I encourage all of you to check on us, Dresden Center Office of Preventive Care Facebook group. And then we present our activities, we present news about health, we present some research that we do on the spot there. Here is a picture of our Christmas party. By the way, just to talk about the Christmas party, Dr. Glenn Blix started a legacy that every year he would have a time close to the end of the year in his house. In fact, he structured his house to have a small auditorium just specific for preventive care students. Well, I could not do that on my house. My house is very humble compared to his house. He even had a pool, and we could go to his house and swim on his pool on those activities. But we try to follow the legacy. Every single year we develop or we implement a Christmas party for our students. And we do that in different places, not in my house, sorry. Maybe one day I will do in my house, but we go to a restaurant. We have been in the last 2 years to Nashua's vegetarian restaurant. We have been to the cafeteria. We have done that in Dresden. We have done to the restaurant, the faculty restaurant in Loma Linda. So we have done good parties for preventive care specialists and the volunteers that help us in the preventive care clinic. Also, we run the annual Lifestyle Health Fair. Unfortunately, this year, 2021, we skipped that. I think the last one was in 2020. And then this is a health fair that we provide all the services, and we invite vendors that are related to lifestyle. We have a newsletter. If you are interested in this letter, just email us, sphpreventivecare@llu.edu. This is a picture of the nurses. By the way, Dr. Selam Stefanos on the right is the instructor that has worked with us for many years to provide this training for the nurses, the registered nurses. And then we have Mary Shun. Also, she was the director of the CHIP program in Loma Linda University. We have worked together for years in the area of prevention, and now she is one of the instructors for the nurses in this training session. And by the way, they pay us for doing that, the training. So we are very thankful for the School of Nursing to value our services, to value what we do in Dresden, and to value the preventive care, the Office of Preventive Care, and then to put their nurses to interact with our students and to be trained for prevention. As you know, when there is a class in a course that we run for prevention with the nurses, and I mentioned that to them that this is the more important course in the program. They don't believe on me, but I tell them that most of the diseases that they are going to deal in the clinics, in the hospitals, will be lifestyle-related diseases. I'm talking about hypertension, diabetes, heart disease, high cholesterol, arthritis, and depression, all related to lifestyle. And then I mentioned, if you just give pills to these guys, you do a disservice. You have to give them lifestyle. It's our motto: preventing and treating diseases through lifestyle. This is a picture of one of our churches that we did in Fullerton in 2016. So why the program is the most important program that the world needs? Well, 70% of all deaths globally are non-communicable diseases. And heart disease is the main one. Cancer, respiratory disease, and diabetes. And then the four diseases are related to four factors: tobacco use, physical inactivity, harmful use of alcohol, and unhealthy diets. As you see here, except for alcohol, all the other three are addressed by Drazen in one or another format. We follow the legacy of Jesus Christ. I came that they might have life and have it abundantly. And that's the end of the presentation. This is a picture of our preventive care Christmas party. And we have the privilege to have our dean of the School of Public Health in our parties. She has been a frequent participant in our parties in the last few years. I need to add one mention here regarding the preventive care history. Is about Dr. Eric Noe. Eric Noe has been a very supportive person for our program since Dr. Blix, or even before Dr. Blix. He is not preventive care, he's a medical doctor, but always supportive of the program. I remember I did an internship in Kaiser Permanente, and Dr. Eric Noe was in charge of the lifestyle program there, and most of the people that were working for him were preventive care. And they have preventive care for smoking cessation, for weight management, for stress management, all preventive care graduates working there in Kaiser. I did my internship with him. And then when I was the director of the program, he was a member of the committee, and he was the one that started the fund that we call Mervyn Harding Fund, that is to provide scholarships and help for our preventive care students. So thank you, Dr. Eric Noe, and for his support for the program. We are very appreciative of that.